Hello, I'm Jim Fasules, a pediatric cardiologist and the Senior Vice President for Advocacy and Health Policy at the ACC. I want to welcome you to CardioSource News, World News. We're speaking today with former Senate Majority Leader Tom Daschle. Since leaving the Senate, Mr. Daschle, along with Senators Dole, Baker, and Mitchell, founded the Bipartisan Policy Center. He continues to remain active in health policy, including serving on the Health Policy and Management Executive Council at the Harvard School of Public Health. His book, Critical: What Can We Do About the Health Crisis, really lays out why we need to change and must change healthcare in a bipartisan way to make it work. We're very pleased to have him here today and to discuss the recent changes that the Affordable Care Act and the Supreme Court's decision, what these will have impact in the future and how they fall short, and what we as cardiologists can do to improve the quality in care. Welcome, Senator Daschle.
Thank you, Jim. Good to be with you.
It's very nice to have you. You quoted in your book that we just mentioned Harry Truman's statement that the time has arrived for action. Has the Affordable Care Act been enough action? There's the Supreme Court making it the law of the land. Are there still things that we need to do? You mentioned the Gordian knots that are out there. Are there still Gordian knots?
Jim, there are a lot of Gordian knots. This is the most transformational time we've seen in healthcare in 200 years in our country. And I think the Supreme Court decision was further transformational in terms of its capacity to sort of lay the framework. But if this were a football field, I'd put us on about the 30-yard line with 70 yards to go.
Oh, we're not even in the red zone.
We're not in the red zone. We still have a long way to go, and both cost access and quality challenges. But we're on the field, and we've got a lot of obstacles on administrative and regulatory, on policy, on political divisions that still remain, and certainly within the states. There's going to be a lot of activity in the states. So on all of those levels, there's still a lot to do, but we're there, and I'm optimistic about getting to the goal line.
Well, you know, you just mentioned the political perspective, and you're in the bipartisan center. How do we get beyond this partisan paralysis that we have right now? You've had some ideas in your book, a few of those.
Well, I think there's a lot that Republicans and Democrats, conservatives and liberals agree on. We agree on the problems. We know that there's a cost, access, and quality problem. Generally, we even agree on what the causes of those problems are. The lack of transparency, the lack of good coordination for chronic illness especially, too much unnecessary care driven in large measure by a fee-for-service system today, defensive medicine. All of those things are areas for which I think there is agreement. The big division is, what should the proper role of government be in addressing these challenges? The Affordable Care Act was the effort to try to find common ground. It failed to a certain extent, but I do think that going forward, we know what we've got to accomplish. We want to build a high-performance, high-value healthcare marketplace with better access, better quality, and lower cost, and not many people disagree with that.
Well, interesting, and you say that in the transparency aspects. One of the problems we see is that we get the data back from Medicare too late, a couple of years late, and we don't get the data at all from the insurers. The ACC, with our registries and things like that, we're very much into the data aspects. How can we get, you had an idea about the Federal Reserve type commission. Would you describe that?
Well, I probably overused the word transformational, but I think two things could make a big difference. First of all, I think it's important for us to have as much of an investment and commitment to health IT as is possible, because therein lies the opportunity for a new health infrastructure that will allow us greater transparency and the tools we're going to need for better evaluation. But you also need a better governance. We don't have a system in the United States. We have a market, and that market isn't very well organized, and so we need a better infrastructure, and therein lies, I think, the opportunity for at least better governance along the lines of a Federal Reserve, in my view, blending public and private entities in a much more effective way. But whether it's that concept or something else, there has to be better coordination than we have today.
Well, you speak of that, and one of the things I would bring up on the health IT is we didn't go the route of having interconnectivity and the inability of the different systems to speak together, and which you can do all the meaningful use. Do you think that they need to get a little stronger in that?
We do. We're making progress, and I think we've come a long way in the last couple of years. We're only at about 25% incorporation. We've got 75% to go. Again, my goal line in the field we're on, but I think we're getting there, and I think you're going to see rapid acceleration of the acquisition of health IT going forward, because so many people understand that is at the crux what we've got to do to allow that data evaluation to be real.
And a lot of people don't understand the difference between Parts A, Part B, Part C, Part D. Is there anything that we need to be looking at as far as solvency and understanding the solvency of Medicare?
Well, I think there's all kinds of huge challenges with regard to Medicare itself. But I think it would be wrong to simply say we can solve Medicare without solving the larger issues involving health, because Medicare is just one of the important, but only one of the players, one of the key parts of the entire health universe. And I think what oftentimes my former colleagues and I used to do and still do today is in trying to address Medicare, we cut and shift. That is, we cut the program and shift the costs onto somebody else. What we really have to do is to redesign and improve. So we're not shifting the costs onto stakeholders or onto beneficiaries or onto states or business, but we're really redesigning and improving the model, and no shifting has to take place.
I'm thinking of BB-8 97, which all my colleagues that know set the SGR up, but also moved some of home health from A to B, and therefore the solvency went out 12 years, things like that.
That's right, a lot of shifting in 97. A lot of shifting,
and I think that also affects us in that if we do more to keep a person out of A, the hospital costs, we cost more in B, and therefore we get hit by the SGR.
Well, that's exactly right.
Yeah.
That's right. There's a connection, and that's the point, is that there's got to be a better realization that all of these connections really have to be integrated more effectively and coordinated. And somebody needs to do that. Congress oftentimes doesn't really have the managerial capacity to do that on a regular basis.
We have just a few minutes left, and I was wondering, our average cardiologist works 68 hours a week. Pretty big workload. Is there anything that we can give them, how their voice can be heard, what they can do to improve the situation in the care and the quality of care?
Well, I think there's always safety in numbers. So involving larger coalitions, involving the nurses, involving other providers, ensuring that we have a Washington presence and making sure that that Washington presence can speak for cardiologists in a more, in as aggressive and as visible a way as possible. I always say that we have to have 20/20 eyesight, interest and involvement in the political and legislative process. The more we can do that with the tools we've got available to us, the more successful we'll be.
It's interesting you said that, because we do really push the team concept of cardiology. I want to make that point. Senator Daschle, we really appreciate you coming and giving us the time today. Thank you very much. Be sure to read the full interview in the August issue of CardioSource World News, or visit the publication online at www.cswnews.org.